Welcome to Backstories Buy-Ins. I am your host, Jafar Chugtai, and today I am here with,
Dr. Justin Reyna.
and I'm here with Justin Reyna. Dr. Justin Reyna is actually my doctor, so I thought I'd get him on here to talk about his specialty and what he does and how he's helped me come back from an MCL tear and numerous other people. So welcome and thank you for coming on.
Super honored to be on here. I forgot about that MCL. We've had a couple other things on you too.
Yeah, I'm all beat up.
Jiu-jitsu will do it to you.
Yeah, it will. Yeah, it will. So, tell me a little bit about yourself. Like you're not from San Antonio, are you?
So I was born here.
Okay.
It's kind of when people ask me where I'm from, I say everywhere.
Uh-huh.
So my father worked for Halliburton for 36 years, I believe.
Okay.
And so oil and gas was booming in the 90s, particularly in South America. So when I was 6 months old, we moved to Brazil. We lived in Brazil, Venezuela, Argentina, Mexico, then South Texas. I moved to Poland, and that's where I graduated high school.
Really?
Yeah, so
Interesting.
at that point, my dad retired. Then 2 months later, workaholic, went to go work for Chevron. And in 2012, there was this idea that we're going to start doing a lot of drilling in Eastern Europe. So we moved to Poland. I graduated high school there. My parents are originally from Pleasanton, Jourdanton area, so 45 minutes south of San Antonio. And then my oldest brother moved to San Antonio while I was graduating high school. And so I said, okay, well, I'm going to move back to the United States. I might as well live close enough proximity to where my parents are from, but far enough to where I can kind of live my own life. So I moved to San Antonio after that.
Really? How old were you when you did that?
I was 18 when I moved back to the U.S.
And where'd you go to college?
So I have 5 degrees.
Yeah, I knew you had I knew you had a few. Yeah.
Yeah. So the first one, I started at UTSA.
Okay.
Wasn't a huge fan of it. It just didn't work out for me. So I moved to Texas State. And that's where I studied exercise science with an emphasis on pre-physical therapy. And at that point, I was like, okay, I want to become a physical therapist. This is the route I want to go down. Happy that's not the direction I went. So I moved back to San Antonio. I was training at Gold's Gym. I was training clients there. And I met my previous business partner. And she said, hey, you should come, hang out at the clinic. Let's see if we can make some use of you. She saw some kind of value in me for whatever reason at the time. And I was bodybuilding. I injured my shoulder. And I did 16 sessions of physical therapy. So I was kind of bummed out about the shoulder thing. But at the same time, I was like, okay, this is like my first introduction to needing physical therapy.
Sure.
Let's see what the dealio is. I'm kind of looking forward to this. Did 16 sessions, 0 change in my shoulder. It was still injured. I couldn't train. At this point, I was feeling, mildly depressed because I couldn't do what I wanted to do. So John Jewett, which is a professional bodybuilder, he said, hey, check out this place in Austin. It's called NewFit. And that's the newbie device.
Oh, okay.
Right. And so I went up there and I trained. I did 2 sessions on it and my shoulder was back to normal.
Really?
100%. I said, oh man, this is really interesting. So I bought a machine. I opened up with my business partner, started. It wasn't called Modern Movement at the time. I'm kind of embarrassed to say what the original name of my business was.
What was it?
Oh God, it's painful. Okay, this was 21-year-old Justin here.
Okay, sure.
Okay, it's called Swole House.
Every PT session came with jacked pre-workout.
Oh, dude, oh my God, Jack. Did you ever take Jack?
I did, yeah. I lived in California when I did that. Yeah.
Miraculous pre-workout.
Yeah.
So my walls were actually red, completely red in my
Oh,
rehab.
wow.
Yeah. So that was the kind of mindset I had at the age of 21.
Swole House.
Swole House.
I love it.
I can't believe I said that out loud. That's still my LLC. So when you get a check from me, it's Swole House. So started using the newbie. I didn't really know what I was doing at the time. So I said, okay, I need to learn. So I went and got a master's degree in rehab science. So I started to understand the principles of rehabilitation, and I applied that with what I learned with how to use the newbie. And I always really agreed with a lot of the methods used in the newbie. Fast forward, I realized that's actually chiropractic neurology principles, which is interesting. I didn't know that at the time. I rented out space to 2 chiropractors here in San Antonio. And this was my first experience working with a chiropractor that was a specialist. So much like medical doctors, chiropractors have the option to specialize. So you can become a chiropractic neurologist, a radiologist, so you specialize in reading radiographs, MRIs, things like that. Chiropractic internist, which is the route that I went down.
What is that?
So, a chiropractic internist is trained for internal diagnosis of internal diseases and disorders. So, that could be like cardiovascular disease,
Oh,
gastrointestinal
interesting.
disease, lung conditions, adrenal conditions, things like that. Typically, what you would imagine that you go see your primary care physician for.
Okay.
And while I was watching these two doctors, Dr. Aaron and Heath Root, I said, wow, they really practice in a way that I imagine this is how doctors should be. They'd put their hands on their patient, they would evaluate them, they would take their time, talk to them, get to know them. They knew about their families and what their kids were doing. They were involved in the community. I thought, wow, that's really beautiful.
Yeah.
I think I want to become a chiropractor. And so I was thinking about it. And then we got this patient that came in. We'll call him M.
Mm-hmm.
M was a quadriplegic when he came in. He suffered a traumatic brain injury. He was in Austin on one of those scooters. He was going about 30 miles an hour, fell, hit his head.
Oh,
It was so bad they had to decompress his brain by removing his skull. And they sent him home without a skull.
really?
Yeah. So he had like a little, you call it a flap on his head. And he was walking around one day and he's feeling good. He's feeling more like himself, right?
Okay.
And he started to go for a jog, slipped and he fell. He
No
hit,
way.
yeah, he hit his head again and he didn't have, the skull to protect himself. So he went from having some speech delays, some mild symptoms from his traumatic brain injury to being in a wheelchair.
Wow.
Yeah, it was really sad. Feeding tube.
Oh man. So he was
Yeah, he wasn't
all the
doing
way.
wasn't doing so good. And we talked to him and his skin would turn purple. He'd start drooling, he'd fall asleep every like 1 or 2 minutes. Like
Oh wow.
he was not in a good spot.
Yeah.
We started treating him. We treated him for about 9 months. And around 6 months, he came in one day and he was walking.
Oh wow.
Yeah, it was really incredible. Leading up to that, Dr. Root was doing some exercises and things that I didn't even know chiropractors did because I was thinking, oh, chiropractors crack bones.
Yeah.
Like a lot of people think, right? And so he was doing these different patterning exercises, hitting reflexes, doing neurologic treatments on M.
Mm-hmm.
And I was involved in the treatment because I was using the newbie. So we were using some electrical stimulation. I was trying to figure out and help whichever way best I could. And a couple months in, I was like, Dr. Root, do you think you should start adjusting Moses? And he's like, oh, okay, we can start doing that. And so we started adjusting Moses while we were doing these exercises. And it was slowly after that, soon after that, that Moses really started to like come back together, right?
Really?
Yeah. I was like, wow, what is this? This is incredible. You sent some stimulation into his spinal cord and it went up into his brain, and now it started creating some different feedback mechanisms for him. And so fast forward to 6 months, he walked in, couldn't believe it. I mean, it was incredible. And he started talking, and a couple months in, before the 6 months, he got that feeding tube removed, and M really liked brisket. So we'd always talk to him like, hey, M, did you have some brisket today? He's like, yeah, man, I had some brisket. I'm loving it. And then, he's just a goofy guy.
Yeah.
Anyways, so now, last I heard, years later, he's living in Austin and he's a financial advisor.
Really?
Mm-hmm.
So that's pretty cool that you got to like put someone's life back together, help them put their life back together after they had such a, huge like accident.
It's probably one of the biggest privileges I've ever had in my life to be involved in that case.
Yeah.
And I'm so thankful to Dr. Aaron for even involving me, because I was grossly unqualified, but he saw some value in me and that lit a match and a fire under me. And that was my initial buy-in to going to chiropractic school.
So that was your main buy-in of where you're like, okay, this is why
This is what I want to do.
Cool.
I want to help people. I want to look at my patient. I want to evaluate my patient. I want to connect with them. I want to help them live a better life. And I just don't know. And again, this is not a knock on medication. I just don't know if symptom management with a pill is the best way to do that.
Sure, of course.
Right. And so went through chiropractic school, fell in love with it. It was amazing. While I was there, I got my second bachelor's degree, which was in anatomy and physiology.
Mm-hmm.
I learned that anatomy is my absolute favorite subject. We, for 1 year, we'd go in a couple times a week and we'd go dissect a cadaver, and I just fell in love with it. I thought it was so fascinating. And throughout that process, I heard about this program called the Chiropractic Internist Program. So, well, what is that? That sounds interesting. What's an internist? So an internist is internal medicine.
Mm-hmm.
And so that's a specialty field within the chiropractic world. It's an extra 2 years of schooling that you have to do.
Yeah.
There's a national board certification that you go through. And you're trained at anything from gastrointestinal diagnosis, stool tests, adrenal salivary index testing, comprehensive blood work analysis through a functional medicine type lens. We use a process called systems biology in our approach. So when we run labs, we always screen for medical diagnosis. Are there red flags? Do I need to get this to a specialist for disease management? And if not, we look at the process from when somebody's healthy to before they get into a diseased state. And we try to find that condition ahead of time so that we can make changes.
Now, this is with blood work, right? You pull someone's blood work. Like, let's say I go to your office. I'm like, hey, I want to try this functional medicine.
Yeah.
And so you pull my blood, and then from there, then what do you do?
Yeah. So first thing we would do is we'd sit down and say, okay, what are the signs and symptoms that this patient has? Have them fill out a questionnaire that breaks down the different health systems and organ systems in the body. And they don't know that. It's kind of placebo.
Sure.
And so we find, okay, this person sounds like they have some GI issues. They might have some blood sugar issues. So I'll run a comprehensive blood panel on them.
Okay.
Then we'll sit down, and then I'll talk about the different things that we found on the labs. You know, your glucose is high, your insulin is high. I may suggest that they wear a continuous glucose monitor so that we can see what their glucose looks like for the next 30 days. Then we sit down and we'll make some nutritional changes. We'll make some dietary changes. We might recommend some supplements. And in some cases, I may refer them to a medical doctor for further workup and evaluation.
If it gets it's too serious.
Yeah,
or
if it's
something.
out of hand, you know,
Yeah.
if somebody has something, yeah, I'll absolutely send them out.
And the goal is to find if there's something going on before it becomes something, right?
Right. So the it's published that about 10% of Americans have a thyroid disorder. I would argue that it's closer to 90% of Americans.
Really?
Oh, yes, absolutely.
Oh, wow.
Some of the symptoms of thyroid disorder, joint pain, fatigue, foggy-mindedness, weight gain, loss of the lateral 1/3 of the eyebrow, puffiness under the eyes, what we call myxedema.
Sounds like jujitsu.
Sounds like everybody in jiu-jitsu. But to me, that sounds like the standard American,
Yeah.
right? Because what are some of the things that affect the thyroid health? Blood sugar dysregulation. If you have high or low blood sugar or blood sugar that's not stable, chronic stress. Those are big players. Nutrient deficiencies.
Which is basically all Americans.
Most people in the United States.
Yeah.
Inflammation. If somebody has a high omega-6 diet instead of omega-3, they're consuming foods that are too inflammatory. They're not eating enough vitamin C. You know, who eats
Yeah.
fruit? Very few people
Yeah,
consume
very few people.
kiwis and vegetables and things
I
of
saw
the
your
sort.
kiwis.
You saw that?
Yeah.
Dude, I'm the kiwi king, man.
Yeah.
Love
That's
kiwis. So that's what we'll do is we'll break it down. And the beautiful thing about this is, so we are an out-of-pocket practice. Where that becomes beautiful is I don't have to justify the lab work to an insurance company. I can order the comprehensive labs that I believe my patient needs. So for example, most of the time whenever you go for a workup on your thyroid, the most common thing that I see is that a doctor will run a TSH, which is a thyroid stimulating hormone. That's the signal from your pituitary gland into your thyroid gland to tell your thyroid to start producing predominantly T4. Okay, that T4 needs to be converted into T3. T3 is the usable form of thyroid in the body. Most of the time, all they're checking is a TSH with reflex T4. What that means is if that TSH is even within range, and by the way, it's a broad range, they won't even see what your T4 looks like.
Sure.
So that's a very limited, close.
Second phase they need to see from the first phase.
Correct. And even if it goes to the second phase, it's still a closed loop to what's happening with your thyroid. I only named 3 labs. There's about 9 or 10 labs that you should really run to get a full picture of somebody's thyroid health.
Interesting.
And many times, people may not be diagnosable hypothyroid, but they're leaning towards having all the symptoms of hypothyroid, and they need to support the thyroid. And in order to do that, you don't just look at the thyroid, you need to look at the systems in which affect the thyroid and this person's overall health. And that's where we come in with a different lens.
So you basically, like, we hate to say it, but the medical system is with insurance is all jacked up, right? So you're able to have a service where it's self-pay, but you do it comprehensively.
Correct.
Without insurance holding a magnifying glass over you saying, what are you doing?
Right. So what I would say is, unfortunately, most standard practices, the insurance company is trying to tell the doctor that they know better than the doctor does.
Right.
Because they're going to either allow you to do this or not allow you to do
Because
this.
it's their money.
It's their money.
Yeah.
And so most of the time you're not getting the gold standard care.
So with your service, let's say I want to go there and I want to get full comprehensive, labs and this whole, medicine thing going on. How much would it cost for me to get set up?
Yeah, so your initial lab work standard comprehensive panel is $350.
Mm-hmm.
Your follow-up with me, which is about an hour, where we break down all the labs, we talk about the game plan and what's happening within your body, that's $250.
Mm-hmm.
And then whatever else we need to do, that can vary. It could be just one supplement, it could be 2 or 3. Nutritional guidance, I'll send them an email with a breakdown of the macronutrients they need to consume, which functional foods they need to consume to support these different systems in the body. I may have to order follow-up labs. I may have to order a comprehensive stool analysis. So it really varies after that, because the whole idea is that it's very individualized.
Sure. So it just depends, but like a basic startup is like 500, and then
Yeah.
you kind of see where it goes from there.
Exactly right. And I think some people may get a little sticker shocked at the number.
Yeah.
But when you realize, number one, you can schedule that appointment whenever you want. You don't have to wait for a referral.
Mm-hmm.
You get the labs drawn immediately, and you get to sit down and actually have a conversation with your doctor.
Yeah.
Do you want to pay less, wait longer, and get
For an hour.
right?
Can
you imagine?
I've never had an hour.
Can you imagine the things that we could talk about for an hour? I
Yeah.
mean, look at what we're going to talk about today.
Yeah, right?
It's pretty cool.
Yeah.
So that amount of knowledge and information and value that you get, I mean, it far exceeds the amount that you pay.
Absolutely. I couldn't agree more.
And I think the same thing is true for our sports med side of our practice, where we do, the multimodal approach with the dry needling. We use red light, we use Winback, shockwave, new fit, spinal manipulation. It's all coupled into one treatment service.
Talk about the dry needling, because a lot of people on my story, they see me posting the needles in my arm or my neck or wherever they are. And like people always message me, are you doing acupuncture? So they don't really understand the difference of what dry needling is or why I'm even doing it. So maybe you could shed some light on that.
I can. I'll try not to go too deep.
Sure.
I've done a podcast where I talk only about dry needling.
Okay.
It's a little over an hour just talking about it. So let's talk about the genesis of dry needling. Dry needling does have some acupuncture influence in it.
Mm-hmm.
So under the John F. Kennedy presidency, people used to say JFK has a bad back. He's known for having pain. Well, what actually happened is JFK had a disease called Addison's disease. That's an adrenal gland dysfunction disease. It's one of the reasons why he was so bronze. He had such a good tan, because of the Addison's disease.
Oh, really?
Yeah. Another thing that it does is it causes a major electrolyte imbalance in the body,
Oh.
coupled with fatigue, spasms, cramps, pain. So the White House physician at the time was like, okay, this is the president of the United States. We cannot give this guy narcotics and opiates. He has to be able to function. Okay, what's this thing? Okay, acupuncture. This looks interesting. They use it for pain. But some of the research didn't make sense. It was kind of like people that were taught acupuncture at the time, and still very much this way outside of the United States, is my grandpa taught me how to do acupuncture, and then this village person,
Yeah.
you know what I mean? So there was a lot of variance in the way it was applied. So they took some of the principles and they applied orthopedic medicine to it, and they blended it together, and they created something called dry needling.
Okay.
So we use very small, thin filament needles,
Mhm.
and it's called dry needling because we don't inject a solution. It's just a needle. And the way that we apply in our approach and what we're trying to achieve is entirely different than acupuncture. So, for example, I always tell people this, and I'm sure acupuncturists would slap me for saying this, but they could put like a needle in your thumb if you have a shoulder pain.
Yeah, I've heard that before. Yeah, I've never
Right.
had acupuncture, but I've heard like they put a needle in your foot for your ear or something.
Right, exactly. Like something that's seemingly unrelated,
Yeah.
right? Whereas in dry needling, I'm very interested in the muscles, ligaments, tendons, nerves, discs related to the injury. So for a shoulder injury, I'm going to put a needle in the muscles that attach to the shoulder, perhaps the neck, the thoracic spine, the shoulder blade, things like that are within relative region, and I can justify biomechanically.
Yeah.
Also, the type of needle we use is a little bit different. So you've seen me bust out some of those long ones, like the one I put
Yeah.
into your trap.
Yeah.
Okay, and the way that we'll peck with the needle is a little bit different, and then we'll introduce an electrical stimulation.
Yes.
So the idea with the needle is I'm going to put it into a muscle, and oftentimes that muscle may have what's called a trigger point. A trigger point is it's a neurologic phenomenon. It's really interesting. So whenever the brain senses instability, that muscle is unstable at one or more of the axes of the joint that it crosses. Okay?
Okay.
So, for example, the trapezius, that's a really common trigger point. The trap attaches into the thoracic spine. The trap attaches into the skull. The trap attaches into the shoulder. So it's all over the place. It attaches into the shoulder blade. If it's weak in one of those ranges, most commonly the neck,
Yeah.
you'll develop a trigger point there because the body wants to stabilize that joint complex. And so that trigger point is a really effective temporary solution.
Okay.
Long term, it's not great because what that does is it creates, like you could imagine a shirt, it creates a really tight segment here, and that's affecting here. And so that creates a crush force whenever we try to move this complex over here. And over time, that's where we start getting joint injury. We start experiencing pain. So when we introduce the needle, we disrupt biochemically what's happening here, which is a deposit of calcium that's causing that. Because calcium, try not to go too far down, it affects the resting membrane potential in a muscle. So every muscle has a resting electrical charge. And whenever we create an action potential, which is a movement, there's a change in sodium and calcium and potassium in the cell that changes the electrical resting membrane potential and cause it to spike up so that movement can occur.
Oh, wow.
Okay, so this calcium it affects that resting membrane potential, causing a spasm or a constant contraction, what we call tetany. And so when we introduce that needle, we disrupt that calcium, and then another molecule named adenosine comes in, and it resets the contractile capacity of that muscle. Then we introduce the electrical stimulation to create an isometric contraction that will carry over into our rehab process. And most typically, before I stop this point, we'll also adjust some of the spinal segments or some of the extremities, because whenever you create a very fast impulse into the spine, it resets the sensory motor system in our brain that changes the tone of that muscle. So now we've made a major neurologic change with the needle, a major neurologic change with the spinal manipulation. We want to take advantage of the neurologic pudding or that neuroplasticity and load the patient through rehabilitative exercise so that we can retrain the way that the brain perceives the joint and the muscle in time and space.
Yeah. Do you remember? So for everyone watching and didn't understand completely, one time you stuck a needle right in my tendon right here or somewhere around here. I had really bad tendonitis last year. And as soon as you stuck it in, it hurt so bad. But whenever you took it out, my tendonitis was gone. And I couldn't believe it. It was like we had been working for like 3 weeks at that point. Obviously, it came back because I keep doing jujitsu, but it was just immediate relief. I never felt anything like that in my life because I've had tendonitis for years.
Yeah. So one of the things that also happens when you introduce the needle is it releases endogenous opioids.
Oh, really?
Yeah. So that alters pain perception.
Yeah.
When you have a chronic pain, you can develop this process called central sensitization. And that's where, if I was to do an MRI, there'd be nothing here, for example. But your brain has created a sense of injury in that area. And so you will have an inappropriate response to pain in the case of central sensitization. And that's where the needle becomes very helpful because it helps reset that. That's why if you look at some of the research, or a lot of the research, dry needling is extremely effective for chronic pain populations, such as veterans at the VA.
That's crazy.
It's really cool.
That is really cool. So you have your practice called the Modern Movement. It's on Blanco near Bitters.
Yep, at the intersection of Blanco and Bitters.
And that's your new location. And how long have you been in business?
So we started Modern Movement, Swole House.
Swole House. Let's just call it Swole
Oh,
House.
no. That hurts me. 8 years ago.
8 years ago. Okay. So, yeah.
That was before I became a doctor. Moved back while I was in chiropractic school. We were still running it. I hired a chiropractor. I had my rehab team still running it. I moved back when I graduated about 2 years ago, and we've been pumping ever since.
Nice. And we were talking beforehand, and you do strongman.
I do.
And you used to do bodybuilding.
That's correct.
Which one's your favorite?
Ooh, okay. I would never do bodybuilding again.
Okay.
I enjoy the training in bodybuilding because it's extremely precise.
Yeah.
It's like being in a laboratory.
Yeah, sure.
That's pretty cool. It's very non-functional. You are an extremely non-functional human physically when you bodybuild.
Okay.
Because everything you do is in a fixed position. You're on a Smith machine. You're on a barbell. Your back's, stabilized. I had a lot more pain when I was a bodybuilder, joint pain, muscle pains. And I had poor relationship with food.
Okay.
and that affected my relationship with people.
Oh, okay.
So, like, for example, if I was strict dieting and I went over to my parents' house and my mom made potato salad, I couldn't eat the potato salad, right?
Yeah, of
And
course.
and at the time that would create an internal frustration.
Right.
And I was, able to identify that years after moving out of the sport. I was like, that's probably not the way I want to live my life.
Yeah.
I think it's cool, the process and the training. I never liked the stage part of it that much, anyways.
Sure.
Strongman to me is really, really awesome.
Yeah.
It's so much fun. It's extremely challenging. There's a lot of technique involved.
Yeah.
I think in many cases, a weaker person can beat a stronger person in strongman if they know how to manipulate the weight.
Okay.
So I would say that strongman has a similar amount of technique to CrossFit, but it
Mm-hmm.
blends more strength than it does cardio.
Okay.
And I feel like if I had known about strongman when I was in high school, that would have been where I evolved from. So in high school, I was 270 pounds.
Really?
Yeah, I was an offensive lineman. I played center. Yeah, dude, I tore it up.
Wow.
And I was a shot putter.
In Poland?
Yeah, in Poland and when I lived in South Texas.
Oh, wow.
Yeah.
Okay.
So loved shot put. That was my favorite sport of all time. It still
Yeah.
is. There's actually a patient of mine that I convinced to do shot put, and
I saw you doing it. You threw it pretty far.
yeah. I kind of suck now, but
Yeah.
once upon a time I was semi decent. But like once a week I go out there and I help him train for shot because I just love it so much.
Yeah.
It's such a technical. It's like playing golf
Yeah.
with a cannonball. So it's
I've heard the same thing with discus.
extreme. Oh, discus is even more technical.
Yeah. Yeah.
Super cool sports. It's actually the most explosive sport in the world. They can generate a full rotational throw in about a second. And then in the Olympics, they're throwing a 16-pound ball like 74 feet.
That's far.
That's super
That's
far,
super
dude.
far.
When you see it in person, it's like, whoa.
Because you see 30 feet, you're like, whoa, that's far. And then the 74 is crazy. Yeah.
Astronomical.
Yeah.
So all that to say is my original, start of sport was always strength and explosion,
Okay.
which favors strongman a lot more.
Yeah.
Bodybuilding, I taught myself how to move super slow and super diligently.
Mm-hmm.
So I think it was important that I did it. It also taught me how to understand how to eat and macronutrients and nutrition, which created a love of nutrition for me, which was the last degree I got was my master's in functional nutrition.
Okay.
And I think had I not gone down the bodybuilding route and lost weight after high school, I never would have found nutrition to be very interesting. I think we always try to learn and teach what we want to learn.
Right.
Right. And so in the process of trying to figure out how to have a balanced diet and be healthy and not go to the far extreme, that's where I studied nutrition.
Yeah. That's cool. Because I'm kind of the same way. I was like doing the bodybuilding diet, bodybuilding workouts. And I did it to lose weight because I was overweight. And then I did lose weight. And finally, I just, I don't know, maybe like 3 years ago, I was like, I love, jujitsu. I love MMA. Why don't I just do jujitsu? And I started doing it and I was kind of okay. And it just took off. Like bodybuilding did help me get to where I wanted to be physically.
Mm-hmm.
And then it just, it progressed into something else.
Yeah. It gave me a strong baseline and then I built from it. So I'm going to reverse the question on you. What was your buy-in to go into jujitsu?
My buy-in?
Yeah, like why did you say, hey, I want to do jujitsu? I know obviously you love the sport of MMA. I've seen you go to UFC. We've been to a few UFC fights.
Yeah.
Never see each
Never
other.
see each other there,
Same
but
thing with
we've
Fury,
been
but we're
there.
always there at the same place.
I guess my buy-in was I went to jujitsu and I beat someone and I was like, dude, that was awesome. And then I beat someone. I was like, that was cool. But then I went against this guy who had been there for like, I don't know, 2 years or something. And I was like, 1 month or something. And he's a little guy. And I was like, this guy, let's see.
I know where
This
this is
dude
going.
folded me up. I was running away from him. I was folding
Somebody
me into,
help me.
Yeah, folding me into a pretzel. I was like, damn, someone like him could do that to me. I have to learn how to not let that ever happen ever again.
Yep. You never want to get little boyed like that, right?
That was crazy. It was crazy. And there's still little guys out there they'll twist me up still.
100%. We're talking about the judo person a while ago. Whenever I was rehabbing her, she had a glute injury. The way they tested at the end of our care was like, okay, I'm going to do, she called it a hip post or something like that. to flip me over, right?
Mm-hmm.
And she did it in a very controlled way. But the way that the power that I felt from that woman whenever she set me up for a flip
Mm-hmm.
was actually a little bit
It's
alarming.
crazy. The leverage on it is nuts.
I think if she had really done it to me, my spine would have exited my body and then
Yeah.
came back in.
Yeah. When she throws you on the ground, yeah, absolutely.
Could you imagine? Oh my goodness.
It sucks. Even on the padded floor, it sucks. So then we put an extra pad out because it's tough on the body.
That's crazy.
Yeah.
What a cool sport. Do you ever have any desire to do the MMA thing, or are you just gonna stick with
I'm
jits?
too old.
No,
Too old.
no way, dude.
Yeah.
Is there Masters MMA? Is that a thing?
No, I don't think so. You gotta go.
Never mind.
I'm 40.
I mean, there's got to be other 40-year-olds kind of getting into it. It would be cool, dude. You could do some Muay Thai and
Yeah, I'm going to do. Actually, I've done a little Muay Thai. I'm probably going to start a little bit more regularly. But do I want to get punched in the face that much? Not really.
just block.
Just stand up.
Yeah, exactly. Just move. You're good.
Yeah, I mean, I'm not the probably quickest guy out there, but I'm probably just going to resort to wrestling jiu-jitsu, honestly.
Hey, there's a
If
lot
I
of
did,
pros
yeah.
that do that.
Yeah, I would just be the guy that laid on top. Everyone would boo me.
Who's the what's his name? You'd be the Daryush.
I'd be the Daryush, man. He's Persian too.
Yeah.
So,
That makes sense.
Yeah.
It just comes naturally. It's like the instinct.
His jiu-jitsu is actually really good.
It's insane. I mean,
Yeah.
of course he's gonna pull people to the ground and
Yeah.
just get points because he's
Yeah.
really good at it.
I'd probably try to be like Hamza, but that dude's a monster.
Mm-hmm.
He doesn't
yeah.
stop moving.
Dude, he's dangerous.
Yeah, and everyone's like, "Oh man, he just laid on top of him." He's like he didn't let like the champion move for like 4 rounds. Like that's holding him in a crucifix. Like
Multiple times.
I've had someone in a crucifix for like 10 seconds. This dude had him for like 25 minutes.
And he repeatedly did it, and there was no point at which the other guy even had a sliver of an opportunity to win. Even when he stood up, he immediately got him back down. Like
Yeah, you knew it was coming, and you still can't stop it.
it was a domination.
Yeah. Yeah. Seeing that type of levels. Let me tell you something. I was at World's Jiu-Jitsu, right? And I was watching the purple belts. No, I was watching the blue belts at Worlds.
Does it go blue, purple, brown?
Yes.
Okay.
So I was watching the blue belts at World's Masters, and I was watching my age range. And I was like, okay, so next year I want to go here and I want to try. I saw a guy and I was sizing him up, from the sidelines. And I was like, okay. And I saw him go, and I was like watching his technique. I was like, I think I can hang with this dude. And then he beat the guy on points. It took the whole round. He's tired. I was like, okay. It's like you go, you have a round off, then you go again because it's tournament style. The next guy he went against, tall, skinny guy, and they went against each other. That guy took him down, mounted him, didn't let him move for about under 2 minutes, subbed him. And I was like, holy shit. I was like, damn, I would have got beat.
So the guy you were like, yeah, I could kind of keep up with, got wrecked.
Got wrecked. But then I saw that guy that beat him go against someone else.
No.
And this dude pulled him into De La Hiva when he had his leg wrapped around him, grabbed his ankle, within 20 seconds, tapped him, straight ankle lock.
So there was layers of domination.
I saw the levels within 20 minutes, and I was like, holy shit.
We got some work to do.
Yeah, it's tough. It's crazy. It's crazy.
Jiu-jitsu is like a spider web of beauty.
It really is.
It's a really cool sport to appreciate.
You see like the way you can move from one move into another and how you just,
Playing chess.
Yeah, it's so crazy.
Mm-hmm.
You don't want to ever do it?
Man, I don't know. I mean, yeah, I would give it a shot. I feel like my bandwidth is so heavy into strongman right now,
Mm-hmm.
and I feel like strongman would make me worse at jiu-jitsu.
We have a strong guy at ours.
Does he do strongman?
He used to.
I think if I was to stop, I could get into jits,
Mm-hmm.
but I just don't think I could do them both at the same time.
I don't think so. No, it's too much on your
I'd
body.
be so beat up.
Yeah, it's too much on the body for sure.
So, and I know if I get into it, I would want to like get into it because
Yeah, that guy stopped doing it years ago. But
Yeah.
he's strong. Like he's very strong.
strongman is such a it makes you strong in crazy ways. You know?
Yeah.
Like I was strong going into strongman. I thought like I could bench press 435,
Mm-hmm.
squat in the sixes, but you put me on like anything where I had to walk with a weight,
That's different.
I was so weak there,
Yeah.
dude. And I'm still trying to get strong there.
Yeah.
Trying to move away
How
from
much do you walk with?
so like a yoke, I think at the OSG qualifier, which was the qualifier for World's Strongest Man.
Uh-huh.
I think our farmer carries were around 600 pounds.
No way.
Yeah.
I can't do that.
So we would do for the event. It wasn't just that either, by the way. We picked up a 300-pound sandbag, ran with it,
No way.
threw it over a yoke, picked it up, ran with it again, threw it over a yoke, then grabbed the farmer and ran as fast as we could.
I'd be so gassed trying to even pick it up.
It's a minute of strongman is a high torque 1 to 2 minute pedal to the metal sport.
Yeah.
And so you have to be really, really, like, your cardio needs to be super good.
Yeah.
For 2 minutes.
That's crazy.
It's insane.
Because you see people like Eddie Hall and Brian Shaw, and you're like, they're big. Like, they can't be that good at cardio. But I mean, thinking about having to do that, holy shit, man.
I'll put it in this perspective. So Austin Andrade, this is all public, and he's fine with it. He's one of my patients. He's the 4th strongest man in the world.
Okay.
He's 6'3", 400 to 420 pounds.
Oh shit.
It varies. When he told me this, I was like, whoa. He's 18% body fat.
Really?
At 400 pounds.
That means his like core must be so big and strong.
It's unbelievable. We got on the bike the other day. He was making fun of me on the assault bike.
No way.
He was making fun of me. He's like, why are you so slow? So I was sprinting, and I was hitting like a little bit over 1,000 RPMs or watts. He hit 2,700 watts.
No way.
And he's 400 pounds.
That's
dude.
crazy.
Think about the torque.
I think I hit 890.
He's a bad dude.
Yeah. Wow, that's nuts.
At his last comp, he did a yoke carry with 1,412 pounds.
Really?
Yeah, he walked with that.
Is he like the strongest? He's 3rd strongest in the world right now?
4th strongest.
4th strongest. That's crazy to be at that level.
It's insane.
He's in San Antonio?
He is. Actually, him and Nick Guardione. Guardione's in the top 10 as well. They're both in San Antonio.
And then the Oberst?
Ryan, what's his name? Something.
Robert
Ober. Yeah, he's in New Braunfels, I think.
New Braunfels, right?
Yeah, and then Trey Mitchell's somewhere in East Texas. He comes into the
Crazy.
clinic. He got 2nd at the Rogue this past weekend, actually.
So we have a ton of strong guys in Texas, huh?
Texas is a strong state for sure.
That's
Washington, for whatever reason, is also pretty big.
I've heard that, actually.
Yeah, I don't know why. I guess because they don't have anything else to do.
Washington State, right?
Yeah, Washington State.
Yeah, that's what I heard. I have a friend out there who does it.
Yeah, dude, it's huge out there. I would say it's probably more common in Washington than it is in Texas.
Okay.
But there's a lot of just really big names in Texas.
Yeah. That's cool.
It's pretty awesome.
So you want to do strongman, no jiu-jitsu, or maybe just try it. Judo, though.
Judo, yes. So really interested in the idea of stand-up grappling, taking somebody down to the ground.
Okay.
I feel like I could manipulate force and weight because of strongman.
Mm-hmm.
So if there was a martial art that, in my mind, and I could be totally wrong, would have some type of concentric circle overlap, it would be judo.
Judo. I think you're right. The only thing I worry about is those trips.
Dude.
Because they come out of nowhere and they'll
Oh.
make you do the splits.
There goes my whole career.
That's what I'm saying. It
You're
could
right.
destroy you, yeah.
You're probably right.
Because they'll pull you this way and you're trying to go that way and they'll pull your other leg out and you'll do the splits. I've seen it happen. It's crazy.
I think I would go radio silent if that happened. Like
In a competition, everyone watching.
just totally rigor mortis. Like
It would probably be a meme forever.
it would have
Guy
to be.
does the splits.
Yep, and just dies on the spot from the splits.
Jeez. Yeah, it's so bad.
Martial arts are just, gosh, they're insane, dude. Like, I think kind of like golf, it's one of those sports that if you ever want to be really, really good, you got to start before you can even think.
Yes.
You know, like
Yeah.
my oldest brother, he started playing golf when he was 3,
Oh, wow.
and he made it to the PGA Tour.
Really?
Yeah. But because it was so ingrained in him that he saw the world as golf, he didn't try to see golf from the world.
Okay.
And I think the same thing needs to be the case, especially in martial arts, because it requires a certain kind of instinct,
Yeah.
right? And if you try to develop the instinct from these preconceived notions and views that you have of the world outside of that, versus this is what you know and now you understand the world, it gives you a completely different appreciation for what you're trying to do.
Yeah. You know, in jiu-jitsu, it's kind of like it's muscle memory.
Mm-hmm.
Like I'm not thinking like, oh, I got to do this. It's like I'm on the fly just doing stuff, seeing what works, that didn't work, and then doing something else and just keep going.
So you don't really think.
Sometimes you stop and think. You're both are stopping and thinking, but usually if it's like a higher belt, they're setting you up for something.
Oh, that's dirty.
Yeah.
So there's an
And
ominous.
if there's like, you're both trying to set each other up, but who's going to do it better? Or you're waiting for the other one to move so you can do your move, basically.
It's tricky. I played a lot of chess growing up. I was on the chess club for.
It's like throwing the pawn out there. You're like giving your arm, and then they go for it, and then you have this one, you shove them the other way.
Or baiting with your queen, right? They take
Baiting
your
with your
queen, and
that's
then
another one. Yeah.
checkmate, baby.
Yeah. So that happens a lot.
That sounds.
There's a brown belt who'd always leave his arm like this for because like a young like lower belts, Americana is like the thing, but once you get higher, it's really hard to get an Americana on someone. So he'll leave it out there for the lower belts. They're like,
yeah, I'm gonna get the Americana.
So they go for it, and then it's like there's no way you're ever gonna get it. He's already out the back way and has your back.
Dude, I couldn't imagine baiting with a body part.
It's crazy.
That is crazy because you're just putting yourself in the line of fire.
You
You're
are.
like, oh, I don't know. You gotta have a lot of.
It's instinct. I've tried it a couple times on lower belts. It works. So
If I ever go to your studio, I'm not gonna go for the Americana.
they actually won't let you roll your first time there.
Oh, good.
They'll just show you self-defense stuff with jiu-jitsu because it's kind of like a Gracie fighting school.
They have a Gracie. I hear a lot about that, and the idea there is that they actually have a curriculum, right?
Yeah, so there's a curriculum. So UFC, right? One, Hoist Gracie comes in and he comes with jiu-jitsu, but he has a little bit of punches, has a little bit of kicks. That's the basic idea of Gracie fighting.
Got it. So they do introduce a little bit of.
Yeah, at our school they do.
well-roundedness.
Some schools there's the jiu-jitsu game where you're playing the game of chess, and there's actually jiu-jitsu fighting.
You know what? I've talked to a few people that are really into martial arts, and they've been doing it for decades. They all say that if you really want to start something, you should do Krav Maga.
Really?
Yeah, and I think they say that because it's applicable to the street,
Okay.
right? And so, like, it gives you a foundation to truly defend yourself.
Yeah.
That's what I've heard.
I've never heard that before. No, I've heard jiu-jitsu and Muay Thai are the best base.
I could see that.
Or wrestling.
I could see that, but I think maybe in the context of competition, that's the case.
Sure.
But in real world application, I've heard that Krav is kind
I've
of.
heard real world application is Muay Thai, so you can hit, get out of there.
That makes
run
sense.
away.
Muay Thai is a very defensive.
Yeah,
It looks very aggressive, and it can be.
It can be,
But their stance is very with their hands up and their pelvis.
You're guarded.
It's really interesting. You get a really good appreciation of what's happening in front of you. It looks like
because if you go to the ground, you don't know if they have friends with them or something. So that's like the main thing about the street is like, if you know you're 1-on-1, sure, you'll be fine on the ground. But if you don't know,
you get stabbed or
wow, you want to run away.
That's
the best thing you can do is run away.
You know, I was at a Krav Maga black belt test one time, and one of the things they were doing was bat defense and stuff like that.
Mm-hmm.
And they would lean into the bat
with what?
Like their body.
Like
if I'm gonna hit you here, they would bring their body into the bat.
Like this?
Or they would do that, or they would actually like lean and shoulder into it. And the idea there, and it makes sense after they explained it, is if you're gonna get hit with the bat, you want to reduce the amount of distance that they're gonna swing the bat at you.
Sure.
Or go into the bat. So number one, they're not expecting it. And number two, you're gonna get hit not as hard.
Yeah.
I was like, wow, that's not what I would normally
I'd be
think.
worried about getting hit in the face. So of course I'd be like this.
Totally, right?
Yeah.
That's crazy. Man,
interesting.
The things to think about, right? Like,
yeah.
I'm so blessed to live in a world where I've never been in a situation like that, you know? But the reality of it is people are challenged with that regularly.
You know what happened is last summer I was in Seattle and I woke up early and I went down to, what's it called? Where the market is? Pike's Place. And I went down there and it wasn't even open yet. And I was like, okay. So I started walking back up to my hotel and I saw this homeless dude beating the crap out of this homeless lady. And I was like, oh shit.
What do I do?
What do I do? And everyone's just standing there looking. And she's like, help, help. And I was like, okay, I guess. So I went over there and I grabbed the dude, put him in a full Nelson. Like his arms were like this. And I had his head down. And then he was like scrambling and she got up, called him some names, tried to slap him. And then I was like, he's screaming help now. He's like, help, help. And I was like, oh my God.
Somebody's gonna put uniform
Yeah.
now.
So I was like, I threw him and I was like, are we going to fight now? So I was like waiting. And then and then he just looked at me and he grabbed his stuff and he's like, next time your muscle man won't save you. And he ran away. I was like, yeah, call me muscle man.
Your 2 minutes of glory, man.
Yeah, it was crazy. But I didn't know what to do because no one was helping. This lady, she was bloodied up.
And people were just watching.
People were just watching. There was a bunch of tourists, old people.
Jesus. Did you have a lot of adrenaline when that was happening?
Dude, I was shaking afterwards because I was worried like I might get stabbed by another homeless person or whatever. You know what I mean?
Right. You never know. Or if he bites you.
Yeah.
Oh, my goodness.
But when I had him like this, I felt like
in control.
I could have killed him.
Well, yeah, he's homeless, right? Like
Yeah,
his muscle mass.
Like there's zero muscle mass, and I knew what I was doing, and I know rear naked chokes, and
dang, dude.
Yeah.
When did that happen?
Last July.
That's
Not
recent.
this past one, the one before.
You have never told me that story before.
Yeah, it was crazy. It was crazy.
Dang.
It happened right after my knee, after I started walking again.
Oh, no kidding.
Yeah.
You were feeling dangerous.
I was feeling, I had to save someone's life.
Right. Well, thankfully your knee was working.
Yeah. Yeah.
You know, I had a cool story today, speaking of knee and like how that immediately led to something positive. This lady, she has chronic back pain, like true chronic pain. She's on drugs that are prescribed.
Yeah.
She has a pain management doctor. She has an orthopedic doctor. She has a whole team of doctors.
What is it, like multiple discs that are?
Yeah, discs, failed back surgeries.
Oh, wow.
You know, stuff that at this point this is a part of her life, you know, because these are
like Ronnie Coleman, basically.
Yeah. You know, not to that extreme because she has function, she can move, but she deals with chronic pain.
Yeah.
This is everything in her world revolves around that, you know. And I put a needle in her hip flexor the other day, and she requested that, and I was like, okay, you know, when patients request something. Like an area to be looked at, I always think about them like there's a reason why they're pointing this out. Let me at least investigate it.
Yeah, of course.
I firmly believe that nobody will ever be a better doctor than you are for yourself.
Mm-hmm.
In other words, if your patient's advocating for their care, you owe them the decency to at least look at it.
Yeah.
Right. So I found a spot. I was like, okay, we can put a needle in here. I put a needle in there. She came back the following week. Actually, it was today, about an hour before I got here. And she said, Dr. Reyna, I was able to walk with my child and go trick-or-treating this Halloween.
No way.
Yeah, and she started crying.
That's amazing.
You know, and like a lot of the patients that come to see me, they're athletes that have injuries.
Yeah.
Right, and we help them get back to their sport, and that's very fulfilling. But whenever you work with a patient like that, and you made such a massive impact in their quality of life to where they could do what we think of as like a really simple.
We don't even think of.
We don't even think about it. Yeah, exactly. Yeah. And you hear something like that, it's like, wow, you know, like the amount of suffering that this person's gone through.
Yeah.
And just how huge that was for them. It really reminds you why you do what you do.
Absolutely.
You know, it's crazy to think about. I saw that a lot when I was at the VA. I did my preceptorship there for 6 months before I got my license. Worked with a chronic pain population, of course. These are veterans that have been blown up, mental health, you know, disorders, chronic pain. I had patients that have had back pain since Vietnam.
Oh, wow.
Korea, you know.
Yeah.
To work with that population that in big part, many of them feel like they're disenfranchised. People aren't supporting or helping them. And in a large part is true because the VA healthcare system is not super great.
Yeah, of course.
Right. So these people put their lives and their bodies on the line, and they suffered and have these mortal injuries or wounds that have affected them their whole life. And so to be part of that treatment team there was also really impactful and formative for me.
Yeah. You know, I think about that because I owned a car dealership, and I had this one night, this lady and this her husband, they both showed up at closing time, and they were like looking at me like, you closing? Like real sad. And I was like, well, I mean, we can go look at cars. So I just show them a few cars and stuff. And then I said, well, it's kind of late. The banks aren't open. I'll probably get back to you tomorrow. They were there before the door opened. And I opened up and I was like, oh, okay. So I was like, these guys, they're serious. So we came in and they were like, well, we've been up and down San Pedro and we went to every dealership and no one can help us. And I was like, really? And then I pulled their credit and I came back and I was like, look, I can get you, but your interest rate, they didn't have the best credit. So I was like, you can get you a loan, but it's going to be a subprime loan. So your interest rate's a little high. And they're like, oh, they were so grateful. And they told me they're homeless and they just got a job where they've had enough to save up and they need a car or else they're going to lose their jobs. And I was able to get them a car and I was like, holy shit. Like I actually helped these people. But then they put it in perspective, like you're helping people walk again. So it's like, like I can just imagine like the gratitude you get from that, experience.
Yeah, it's incredible. But to what you did too, I mean, you allowed these people to keep their livelihood.
Yeah.
That's huge.
Yeah.
The mental health piece of feeling supported.
Yeah.
Whenever you've been in pain or you're struggling financially.
Yeah, they'd walked all the way up and down San Pedro, they said. And I was
walked,
like,
man.
Yeah, they were walking.
Incredible.
Yeah.
It's just, it's really eye-opening to see
Yeah.
the kind of suffering that exists in this world sometimes,
It's sad, yeah. And I couldn't tell they were homeless at all, so I was just very surprised.
Wow. And, in my experience, and it goes both ways for sure, a lot of these people are so grateful.
Yeah.
So grateful.
Absolutely.
Yeah. Incredible.
So what's the future for modern movement?
Man, that's a good question. We were talking a little bit about it at
the
your
shops at the shops at Babcock.
Yeah, let's plug that real quick. I don't know. I would like to open up another location for sure.
Okay.
I think it'll be easier to scale in San Antonio.
Mm-hmm.
I would definitely like to open up in Austin at some point. It's
okay.
a great market for it.
Yeah,
for
of course.
Sure. We do a lot of the physical med stuff, and I think we do it in such a way that is very unique, especially in the San Antonio physical medicine department. San Antonio, unfortunately, is really far behind when it comes to sports med stuff, right?
Yeah.
Super far. And I wonder if that's because we only have one professional sports team. I don't really know what it is. But I know for sure there's nobody that does the combination of services and the approach that we have at Modern Movement. So it's something truly unique and special. So I would like to expand that. I do want to get more people involved in San Antonio.
Yeah.
Particularly because I believe the secret ingredient to what we do at Modern Movement is two things. Number one, it's educating the patient and making sure that they're involved in every process of their care.
Mm-hmm.
That alone is unique in the medical world.
Yeah.
Number two is the secret ingredient to healing is and will always be love.
Yeah.
If you can show your patient that you truly care about them and you love them, at Parker, there's these 10 success principles. One of them is loving service is my first technique.
Okay.
Right? If you love serving these people, if you truly, truly love it, they're going to get better. When I was at the VA, my supervisor, I won't say his name, he admitted to being a terrible doctor. He's like, I'm a bad doctor. And I knew I was a bad doctor. So what I would do is I would express so much love and affection and gratitude and warmth towards my patients, and they would all get better. Many of them would get better. There was another doctor that I worked with, very mechanical, very good doctor, not likable.
Yeah.
Did not apply
the
that.
Typical doctor, yeah.
Yeah, couldn't have been more different than this other doctor. And nobody wanted to see her.
Oh, wow.
Her patients typically didn't get better, right? So to circle back, involving the patient, educating the patient in the community, and then loving the patient. If we can take those principles and continue to apply that to every expansion of Modern Movement, the goal would be to have multiple locations.
Yeah.
With the ultimate idea is to educate and bring up everybody in the community around us.
So you really have to have it. It's not just a franchise. It can't be. It has to be run completely the way that it's run right now.
It has to. If I wanted to just make a franchise and make money, I'd get into pest control. Right. Something that's not
Chick-fil-A.
Chick-fil-A. Oh, definitely. Right. They have a system.
Yeah.
But for it to be this thing,
Yeah.
for it to be Modern Movement, it has to be done the right way.
Yeah. That's why I keep going back to you every time I get injured.
Thank you. I think that's why a lot of people do, honestly.
Yeah.
Like that's whenever we expanded this past month to the new location,
Mm-hmm.
we generated 72.5% more revenue
Oh, wow.
than our busiest month ever.
Congratulations.
Thank you. But really, what that is, because we did a really terrible job of marketing, we did a really bad job of notifying people where we were going. We did a bad job. I'm still not on Apple Maps. Like, I've done a lot of things wrong
Yeah,
as a business owner, but people still come to see us, and more and more people are coming to see us because of the way we do stuff.
that's awesome.
It is awesome, and it's really reassuring.
I mean, you were recommended to me by Alex a long time ago. Then Shay recommended me to you. She was going to jujitsu with us. So it just, and then I win, then I recommended more people. It's just, word of mouth, really. It's because it's good service.
Yeah, we try to do our best, and I think the best marketing will always be grassroots.
So I ask everyone this question, and I think for you, it could be multiple things, or it could just be one encompassing thing, which was probably helping people get better from the inside out. What was your buy-in moment for that?
Why did I start doing that?
Yeah. What was the moment where you said, I want to just do this forever?
Probably after that patient, the quadriplegic.
That was it?
That was the biggest one. But it's hard to say because at that time I wasn't doing a good job of the inside part,
Okay.
right? I wasn't doing a lot of the internal health, the biochemistry. I think it's when I was in chiropractic school and I started to truly understand how the body works. What's really cool about the chiropractic profession is we are definitely in spinal manipulation the most trained profession.
Yeah.
But even that encompasses maybe 5 to 10% of our schooling.
Okay.
The majority of our school is biochemistry, neuroscience, anatomy, physiology. We get pharmacology, patient management, a lot of different things. We are also the most trained in anatomy. We're the most trained in physiology, and physiology is the study of how the body works, and biochemistry. So understanding the intricacies and the metabolic pathways in the body, I started to look at musculoskeletal pain. I said, if we're not looking at what's happening internally at that area, we're doing a disservice to the patient.
Right.
This is an inflammatory condition. And if this is chronic or if this continues to pop up, there's no doubt that there's likely a biomechanic issue, but there's also a cellular issue that's taking place.
Yeah.
If we're going to do this, we should do it right? Because if it's happening there, it may be happening in the cardiovascular system, maybe happening in the brain, it may be happening in the liver, maybe happening in the gastrointestinal system. And when you start breaking it down and extrapolating and asking your patient questions, you find out, wow, they have so many other things that are delaying their recovery of their injury.
Yeah. That's pretty awesome. There's the layers to it. It's like jujitsu,
There's
crazy.
There's so many layers, and I think that is what continues to attract me to my profession.
Yeah.
Is
That's awesome.
If it was A plus B equals C, I would have got bored of it a long time ago.
Absolutely.
There's just so many different. It's like being in Inception.
Yeah. Yeah, it is, right?
Yeah, it's so cool.
So we're going to do this new thing that I kind of started where it's this or that. So I already did bodybuilding or strongman, and you went with
Strongman.
strongman. Cardio or weights?
Weights. This is for me, right? Not for
Yeah,
patients.
for
but
you, yeah.
Also weights for patients too.
Cats or dogs?
Dogs. I have an English bulldog. She's
Oh,
so
do you?
beautiful. Madeline.
Rice or pasta?
Gosh, that's a hard one. Probably rice.
Okay, I would choose probably the same.
I could eat rice more frequent than pasta.
Fruits or veggies?
Ooh. Fruits.
Okay.
Veggies are better for you, mostly, but I think fruits are yummy.
Okay. Newbie or dry needling?
I'd never agree to a world of just one anymore.
Well, you had to pick one.
If I had to pick one, probably newbie.
Oh, okay.
And I say that because I think active care and empowering your patient with movement to have agency over their condition is very important.
That's cool. That makes a lot of sense, actually.
Yeah, you get more yield for that, but why not do both?
Judo or jujitsu?
Oh, judo.
Judo, 100%.
Yeah, I want to slam somebody through the earth. Have them keep falling.
Your poor trading partner.
Yeah, it's gonna be Trey.
And Nike or Adidas?
Adidas
Really?
for sure.
I'm a big Nike guy.
Adidas is more swag, dude.
Yeah. Basketball or football?
Football, million billion %.
Combat sports or football?
Combat sports. To watch, yeah,
Yeah.
combat sports.
And you were at Strongman, CrossFit or Strongman?
Strongman, gazillion times.
Bodybuilding or Strongman?
Strongman.
I mean, bodybuilding or CrossFit. Sorry.
To watch or to do?
To do?
I would do the training of bodybuilding. I would do the competing of CrossFit.
Okay. That's a good answer. And last one. You had posted this the nutrient dense foods on your story the other day. That Icelandic.
Oh, the skier, the yogurt.
That's what I get too.
Dude, that stuff's so good.
It's great.
I love it.
That or kiwi?
No, this is dirty. What a dirty question. I go kiwi.
Okay, wow.
That was hard.
I got to get on kiwi then.
Dude, get on the kiwi game. Eat the skin.
I can do that. Yeah, I don't care about that.
Yeah, what I do is I pull like the little hard knobs at the top off, and then I just eat the kiwi. You can wet it if the hair bothers you on it because it kind of mats down the hair of the kiwi.
Sure.
But just eat the whole kiwi like an apple.
I can do that. That's easy.
Yeah, it makes it so much easier to just smash it back.
Good fiber.
Super good fiber. Really good for your neurotransmitters. Neurotransmitters are essentially hormones in the brain that affect your mood and your sleep.
Let me ask you something. How do you pick out a kiwi?
How do I pick out a kiwi? So I go and I grab it. If it's a little squishy, I don't get it. But if it's too firm, I also don't get it. So it's kind of Goldilocks.
It's like a damn avocado.
It's the same thing. Yeah, you approach it the same way, except you don't pop the top off like you do an avocado.
Yeah. Interesting.
That's a sneaky trick. You got to pop the top of the avocado off.
Okay. Cool. Well, you want to pop my neck?
Yeah. Let's do it. Okay, let's get your neck adjusted.
Okay. He's going to, for everyone watching at home, this is going to be the first time on this podcast where someone gets up and he's going to pop my neck.
Is this a good spot to have it recorded?
Yeah, I think so. The camera's right here.
All right, let's see what we got going on here.
Try to get the microphone in there so you can hear.
Okay, so here's the first one.
Oh, wow, that was good.
All right, here's another one. Right across here.
Oh. That was so good.
That was awesome.
I hope that got on. I think it did. It was loud.
That had to have been 100%.
So, Justin, Dr. Justin Reyna, I want to thank you for coming on.
You're very welcome. It was such a pleasure to be on such a prestigious podcast.
Thank you.
You and I have been, doctor, patient, and also friends for years.
Yeah.
So it's really cool to get the opportunity to participate with you in this way.
Thank you. Where can everyone find you?
So the Modern Movement _ is our Instagram.
Okay.
We're located at 14855 Blanco Road, Unit 450, off the intersection of Blanco and Bitters in San Antonio, Texas.
Awesome.
And then my personal Instagram, if you want to see like some kiwi stuff or some nutrition stuff,
Yeah.
is drjustin.reyna.
Awesome. So thank you for coming on, and we expect to see some reels soon on social media, and thank you guys for tuning in.
Thanks, guys.